Nursing is one of the, if not the most respected profession in the world today. But did you know that this has not always been the case? Many nurses that have come before us paved the way for our nursing profession to be what it is today, an honorable and respectable profession. Magandang umaga sa inyong lahat. My name is Dr. Jeffrey Reboron and welcome to another pre-recorded lecture for the subject Theoretical Foundations in Nursing. Please bring out your notes and follow along our discussion. Last week, we discussed about the conceptual versus the theoretical definitions and also the nursing meta-paradigm. We also had a look at the philosophy of nursing and the scientific method when it comes to nursing and nursing theory. We also discussed about the cognitive process and the different sources of knowledge. Many things have been covered last week, but fear not, because all of the knowledge that you gained from last week's discussion will still be carried over to our discussion in this video. In this video, we will be learning about the 4 ways of knowing in nursing and the evolution of nursing, along with the different professional roles of nurses in the 21st century. Let's begin learning, shall we? Let us start with the 4 ways of knowing. The first way of knowing in nursing is what we call empirical knowing or empirics, which is defined as the scientific discipline of nursing, which is factual, descriptive, and it helps to develop abstract and theoretical explanations. Lagi niyong tatandaan that when we say empirics, it is based on or it is concerned with or verifiable by observation and experiences rather than a theory or plain logic. Ibig sabihin nito, empirical knowing is the science of nursing which is usually based on factual information, on descriptive data that helps us to develop abstract and theoretical explanations about something. We nurses can demonstrate our empirical knowing on a practice level through a competent performance of activities that are supported by theory. So, ibig sabihin nito, when we are practically practicing or bridging our knowledge on theories to our clinical practice, that means empirical knowing. So, ibig sabihin nito, we are converting our knowledge on theory, on knowledge on medicine and science, and then we are converting it into something that is part of our expression of care. In Ilocano, no ipakpakat mo, dagitaam mo, when it comes to nursing, then that is what we call empirical knowing. Or in Tagalog, pag yung mga kaalaman mo regarding sa theories of nursing ay ginagawa mo or practice mo in the clinical field, then what you are doing is empirical knowing. Now, another way of knowing is what we call ethical knowing. When we speak of ethics, they provide the moral directions of nursing. And ethics are usually involved in the morals that are associated with the choices in the treatment of our patients. Lagi niyo pong tatandaan na as nurses, we need to have ethical knowing because this will enable us as healthcare practitioners to consider the morals or the ethical legal problems that are associated with the choices of treatment for our patients. Now, you have to remember that this type of knowing will also allow us and empower us to know what ought to be done or what one is obliged to do. Now, ethical knowing includes the ability for the nurse to evaluate the motives, the values, the characters, and the norms that are encircling the treatment of a patient. Lagi niyong tatandaan that as nurses, we need to have ethical knowing and we need to abide by the standards of ethics and the laws of the land. Lagi nating tatandaan that ethical knowing is important for us to make our ethical and professional judgment. Dapat binibase natin ang ating mga decisions, ang ating mga actions when it comes to the correctness or badness of something, yung rightness or wrongness of something. As nurses, we should always possess ethical knowing so that we can balance things out. Kasi sa ating clinical profession, hindi naman po laging lahat pure white, pure black. There are always a gray area. And we use ethical knowing to always use or to always choose what is less evil or what is better for our patients. Another way of knowing in nursing is what we call personal knowing. Personal knowing is defined as the method by which nurses approach the client through his or her own experiences. The personal way of knowing is the knowledge that we have as individuals or as people about ourselves. And this knowledge that we have about ourselves usually colors or directly affects our interaction with others, and it also encompasses experiential learning. Personal experience can help us, nurses, to have a better understanding about the patient situation and about our roles as nurses. Gaya nga ng sabi nila, if you know yourself, if you know what your philosophies are, your characteristics, and your strengths are, that will situate you better to become nurses who are caring for different types of clients. Kasi kung hindi mo kilala ang iyong sarili, then you will never understand other people as well. And as nurses, napaka-importante sa atin na alam natin ang ating mga sarili. We know what we want. We know our philosophies as nurses, as human beings. We know our characteristics, our strengths and limitations. Because these type of knowing, this self-awareness that we have will actually become helpful when we become nurses in the clinical field, because we can use them to understand the situation better, to understand the needs of our client better. Di ba nga pag yung isang pasyente, kunwari, ay meron siyang rheumatic heart disease, and you also have an experience when it comes to having rheumatic heart disease. Maaaring ikaw mismo may sakit na ganon, or maaaring nakawitness ka ng isang family member na may sakit na rheumatic heart disease. Now, because of personal knowing, because of the experiences that you have over the years, you are able to better understand what the patient is going through because of your self-awareness. So dapat po as nurses, we should become very self-aware so that we can become better carers for our patients, and we can also express our care better to our clients. Now, another way of knowing in nursing is what we call aesthetic knowing. When we speak of aesthetic knowing, it deals with the empathic aspect of nursing and is regarded as the art of knowing in nursing. Kung kanina po, sa personal knowing, it is how we understand ourselves, our self-awareness. Dito naman po sa aesthetic knowing, it is how we understand other people. Okay? So yung kanina po sa personal knowing, sarili natin ang iniintindi natin or tinitignan natin so that we can better understand ourselves, and by understanding ourselves, we can better position ourselves to become carers of other people. Dito naman po sa aesthetic knowing, we now look at the person that are adjacent to us, which are actually our recipients of care. Yung mga pasyente naman po natin ang ating mga iniintindi at ang mga ating ina-analyze. When we speak of aesthetic knowing, it is often described as the art of nursing, because this way of knowing paves the way for the nurse to form a sense of the patient's needs, and then they act on their behalf. Ibig sabihin nito, because of aesthetic knowing, we get to understand what the patient really needs, even beyond words. May mga instances wherein yung mga pasyente, may mga hindi sila sinasabi, pero as nurses, we get to interpret what they are trying to hide. As nurses, we are able to read between the lines because of aesthetic knowing. Kunwari, may isang pasyente sa iyo na pumunta sa inyong hospital and then sinabi niya, "Sir, ito po yung sakit ng anak ko." And then the doctor ordered prescriptions to the patient. So may mga gamot kang sinabi sa mga pasyente and then sinabi, "Sige po, ma'am." And then the patient just smiled and walked away. And alam mo na lang, by aesthetic knowing, by using aesthetic knowledge, alam mo na yung patient na yon, dahil lang sa smile na ginawa niya, ay hindi niya bibilhin yung gamot. And then you will say, "Ma'am, ano pong problema?" And then the patient will say, "Sir, wala po akong pambili ng gamot na ganito." So, ibig sabihin, when you have aesthetic knowing, you are able to understand other people. You get to become familiar with how they think, how they act. You get to interpret their non-verbal and verbal cues. And dahil sa ginagamit mo yung aesthetic knowledge na yon, you are able to plan and orchestrate a better and effective way of providing care to your patients. So lagi niyong tatandaan po, now when it comes to nursing, we do not just look at ourselves. We also look at our patients and understand where they are coming from so that we can better situate ourselves when it comes to expressing our care to our patients. Now, gaya nga ng sinabi po natin kanina, when we speak of empirical knowing, it is based on the facts, on theories, and on sciences. Dito po pumapasok yung mga normal values, yung mga theory na ginagamit natin when it comes to the care of our patients, and dito po pumapasok yung research and statistics. Now, when we speak of empirical knowing, it deals with hard sciences. Dito po pumapasok yung knowledge natin on pharmacology, mga knowledge natin when it comes to medications, some normal lung values, normal vital signs, and other things like that. When it comes, it has something to do with numbers, mga ganitong tipo po. Now, empirical knowing focuses on evidence-based research for effective nursing practice. Now, lagi niyo pong tatandaan na as nurses, we really are using the science and art of nursing. Science, ibig sabihin, we use hard sciences. We use our knowledge when it comes to technology. We use our knowledge when it comes to medicine. When it comes to hard sciences nga, na it involves mathematics, it involves numbers, it involves normal values, it involves truth and factual evidence. Now, ginagamit po natin ang mga factual evidence na ito in our nursing practice because it is safer that way. Mas maganda po na objective yung mga data na ginagamit natin kesa po we are asking for other people for their opinion. Okay? Kasi nga po when our practice is based on evidence, it is safer for our patients. Now, like I said, empirical knowing is also known as the science of nursing because dito po sa empirical knowing, ginagamit natin yung mga fundamental knowledge that we have when it comes to science, biology, chemistry, pharmacology, kinetics, mga hard sciences, ginagamit natin yon in our practice. Okay? So that is why nursing is considered a science because we use empirical knowledge that are based on hard facts and evidences. Now, any scientific or research-based or theoretical and factual information and knowledge from lectures, textbooks, and journals are considered empirical knowledge. Now, na-mention natin kanina yung evidence-based practice. Ano ba kasi ang EBP or evidence-based practice? Now, EBP involves integrating the best available evidence or products of research with clinical knowledge from our industry experts, expertise from the people who have come before us in the nursing profession. Aside from that, we also consider the patient's unique needs and personal preferences, yung mga gusto ng mga pasyente natin. Now, In evidence-based practice, pinagko-combine natin yung best available scientific evidence that are part or outputs of research studies. Tinitignan din natin yung mga opinion or yung mga practices of industry experts. And then we also consider the values and the beliefs and the preferences of our patients. So pag kinumbine po natin yan, we come up with the best treatment for our patients. And that is what we call evidence-based practice. Now, bakit ba importante ang EBP sa ating generation ngayon in the 21st century? You have to remember that using evidence-based practice means that we should abandon our outdated care to our patients. Yung mga ginagawa natin noon pa, which are basically just born out of practice, mga ginagawa kasi dati nila na wala naman silang solid evidence or solid grounding kaya natin sila ginagawa. Now, we should abandon these practices because they may prove dangerous to our patients. So, ibig sabihin, pag gumagamit po tayo ng EBP, we are willing to change our practices. Kalimutan natin yung mga dating ginagawa natin as nurses and embrace new means or ways of treating and caring for our patients that are more effective, scientifically sound and validated, and also that meet individual needs. Kasi may mga ibang practices po tayo na hindi naman po tama at hindi naman din po gusto ng mga pasyente. I'll give you an example. Yung tinatawag natin na fundal push. Dati-dati po, pag yung isang babae nag-iire, the mother is bearing down, what the nurses or midwives would do is they will also push the fundus of the uterus. Idurundamet di matres de di babae nga pababa. Now, because of evidence-based practice, we found out that from research studies, mas magiging dangerous or mas magiging pangit yung outcome ng delivery or labor na yon when we do fundal push. Because of evidence-based practice, nalaman din natin that patients who are recipients of this fundal push, yung mga nakaramdam kung paano ma-fundal push, ay sobra pala silang nasasaktan. And if they have a choice, mas gugustuhin nilang hindi makareceive ng fundal push. And even doctors and nurses are saying that when a midwife or a nurse does a fundal push to a patient, mas nagkakaroon ng dystocia or difficulty of labor. So, because of combining yung mga evidence from research, mga patients' preferences, and clinical expertise and experiences of these experts in the profession, nakakome up tayo ng isang EBP or evidence-based practice na hindi na natin gagawin ang fundal push in the delivery room. So, lagi nyo pong tatandaan that evidence-based practice is important for us in the clinical profession because, in the clinical field, I should say, because it helps us to abandon those outdated practices that we have, and it also elevates the kind of care that we give to our patients. Now let us also zero in on aesthetic knowing. When we speak of aesthetic knowing, it is related to understanding what is significant to a particular patient, such as their feelings, their attitude, and their point of view. Gaya ng sinabi ko kanina, when we speak of aesthetic knowing, it is understanding our patient, their perspectives, their characteristics, their strengths and weaknesses, and even their motivation kung bakit nila pinipili or ginagawa yung mga bagay-bagay. Now, in aesthetic knowing, it is the comprehension of meaning in singular, particular, or subjective expression that we call the art of nursing. Dahil nga sa aesthetic knowing, coming from the word aesthetic or maganda, we use aesthetic knowing as our way of expressing how beautiful our nursing profession really is. Bakit? Because we get to interpret the feelings and emotions of other people. We get to understand other people. We get to incorporate these feelings and emotions into the way we express our care to our patient. Kaya nga po, when it comes to aesthetic knowing, it is also known as the process of giving appropriate nursing care through understanding the uniqueness of every patient, thus emphasizing the use of creative and unique styles of care. Gaya nga ng sinabi ko in our previous videos, our characteristics, our perspectives, the way we were raised by our parents usually define who we are. And that is also the case for our patients. Yung mga pasyente natin, iba-iba po yan. They are like a kaleidoscope of individuals that come to us for help. Ilan sa kanila, iba yung creed, iba yung mga political views, iba yung religion, iba yung sex or gender, iba din yung kanilang mga looks or mga motivations. Iba-iba po tayo ng mga pinanggalingan. We come from different walks of life. And because of that fact na tayo po ay iba-iba ang pinanggalingan, ibig sabihin lahat po ng mga pasyente natin, we have different needs when it comes to being cared for. Pag yung isang pasyente, dalawang pasyente, kahit sila ay pareho ng sakit, both of them will need a different approach when it comes to caring for that patient. Kasi nga po, in aesthetic knowing, we take into consideration the feelings, the attitudes, the point of view, the preferences of these people. Kaya nga po siya tinawag na art in nursing. Kasi nga po sa art, when we speak of art, kahit na ulit-ulitin mo yung isang art na yon, meron at merong mababago doon. Same is true with our care for our patients. Even if we are caring for the patients with the same illnesses, ang mangyayari is we still have different approaches. Mag-iiba at mag-iiba po yung mga treatment or expressions of care na gagawin natin sa mga pasyente. And all because of aesthetic knowing. Let us also zero in on ethical knowing. When we speak of ethical knowing, it is the knowledge of what is good and right, the bad and the evil, the correct or the wrong in making moral actions. Ethical knowing is usually involved when it comes to code of morals. And ethical awareness is usually the act of recognizing the ethical implications of all our nursing actions. And it is usually the first step in our moral action. Ang ibig sabihin niyan, hindi po lahat-lahat ng mga situations or actions na ginagawa natin as nurses are morally correct. For example, euthanasia or mercy killing. You know full well that a patient who is already comatose will have 0 to no chance of surviving. And alam natin, based on our moral standards, that euthanasia or killing taking a person's life is not acceptable in our religion. Pero pag tinignan mo yung pasyente na comatose na, everyday siyang nandun sa hospital, nakikita mo you're providing care to that patient. And that patient, you see, is suffering every day. Nakikita mo din yung mga pasyente, yung mga bantay ng pasyente, I should say, nagkakaroon na rin sila ng mga financial struggles. Bakit? Because they're trying to maintain that person in the hospital. So alam mo, naghihirap yung pasyente, naghihirap din yung kanyang mga bantay, pero alam mo din that it is morally incorrect to take a person's life. So that is a good example of how there are things that we do in the hospital that are sometimes morally wrong, but they are acceptable. Bakit? Because of ethical knowing, we are able to balance out the things that we do good and the things that we do that are not morally correct. Ang ibig lang sabihin nito, as nurses, we are placed on situations wherein we get to choose what is less evil for our patients. Alam natin na pangit ang kumitil ng buhay, pero alam din natin na pangit or masama na panuurin na lang yung isang tao na naghihirap at yung isang pamilya din na nalulugmok sa hirap. So as nurses, we should have ethical knowing for us to be guided of our actions. Kasi may mga bagay na ang alam natin tama, ang alam natin walang problema, but it may be seen by our law to be illegal. Okay? So that is ethical knowing. This means that when we have ethical knowing, it compels us nurses to recognize the potential ethical repercussions of the actions that we do. Dapat alam natin yung mga bad consequences or good consequences ng mga bagay na ginagawa natin in the hospital so that we can effectively resolve problems and address patient needs. Okay? Now, ethical knowing is deeply rooted in the concepts of human service. Ethical knowing is deeply rooted in the concepts of human dignity, service, and respect for life. Now, as nurses, lagi niyong tatandaan that ethics within our healthcare field or healthcare profession is important because we, as nurses, must recognize healthcare dilemma. May mga bagay tayo na sometimes hindi natin maintindihan kung tama ba siyang ginagawa or mali. Because sometimes your profession will compel you to do this while your conscience will tell you not to. Okay? And we can use ethical knowing to make good judgment, to make decisions that are based on our values and on the values of our patients so that we are not violating any laws of the land. We are not stepping on our boundaries when it comes to morality, our ethics, and professionalism. So, ang daming mga sinusunod ng mga nurses. May mga ethics, may mga legalities, may mga morality, at ano-ano pa. And ethical knowing will tell you what to do when things become blurry and when things become vague. So, dapat alamin mo kung ano yung mga personal philosophies mo. You need to know yourself. You need to know your beliefs so that ethical knowing will follow. That will be your guiding light when you become nurses in the future. In this slide, we will be focusing on what personal knowing is. As defined earlier, personal knowing is the knowledge of self in relation to others and of the self. So, ibig sabihin nito, ito po ay self-awareness, kung gaano mo kakilala ang iyong sarili. Now, personal knowing is the entirety of the nurse-client relationship because when a nurse understands himself, he is also placed in a better situation to understand the patient and create a long-lasting nurse-patient relationship. Remember that personal knowing is always the key to comprehension in health in terms of personal well-being, and it also involves the therapeutic use of self. Kung ikaw po ay isang nurse na self-aware, you are able to dedicate yourself, your time, your energy, your knowledge into caring for your patient. Yan po yung tinatawag natin na therapeutic use of self. Now, kunwari, I'll give you an example. Kunwari, ikaw yung isang nurse na, ikaw yung isang tao na gusto mo na kapag ikaw ay malungkot, someone is there for you, showing them their presence. Okay? Now, so alam mo na yung inyong, ang gusto mo ay lagi kang may kadamay pag ikaw ay naghihirap or may pighati. Now, you came across, when you become a nurse, you will come across a person who will lose a family member. Maaaring namatay dahil sa sakit, namatay dahil sa aksidente, or namatay kahit na ano pang rason. So, you will meet people who are grieving and at a loss. Now, Since you know yourself, alam mo na it brings comfort when someone comes to you, gives you tissue, taps you on the shoulder, or prays for you. Dahil sa alam mo yung mga gusto mo din na type of care na gagawin nila sa'yo pag ikaw yung nandun sa position. When you become a nurse, those are the same things that you will also give to your patient. Kasi ganun ako. I know that when I am down and out, I need someone to be there for me. Kahit na wala siyang sabihin, kahit na hindi siya nagsasalita, as long as I know that someone is there beside me, that I am not alone when I'm facing a big problem, magiging okay ako. I will feel better. So pag nagkakaroon ako ng mga pasyente na namamatayan, what I do is I sit beside them, I ask them what they need, and then I give them a tap on the shoulder. I pray with them. Or I just tell them that I'm there. I offer them my presence. Bakit ko ginagawa yon? Because I know myself and I know that that is the kind of care that I would also want if I am in that situation. So ibig sabihin nito, our personal knowledge of ourselves involves knowing and encountering and usually actualizing our individual self when it comes to our expression of care to other people. Personal knowing brings us to a place of knowing what we need to do for our patients. Okay? Personal knowing is the basis for the expression of an authentic or genuine self. And it is also essential for a healing relationship. And it is fundamental to the essence of what it means to be human. Kung alam mo kung sino ka at kung alam mo kung ano yung hirap na dinadanas mo, alam mo din kung paano makiramay sa mga pasyente if you will be placed in a situation na ikaw na din yung nurse. Okay, teka lang, wait. Looks like masyado na tayong nagiging seryoso. Let's do an attendance check po muna. Now, for our attendance this week, I will need you to send a voice memo on our Facebook Messenger or group chat. Dapat sa voice memo na yon, you have to think of a pamatay or killer linyahan ng mga magulang or guardian nyo kapag sila ay beast mode or nagagalit. Dapat palupitan po tayo ng sagot. I'll go first. Kung yung nanay ko ay galit sa akin dahil hingi ako ng pera, what she usually says is, dawat ka lang nga dawat ti kwarta, niya pinagkitkitam kanyak, ang taktakiyak kwarta. Your turn. That's how I will check your attendance. Now, let us also study the evolution of nursing. You know what? This topic has always intrigued me. Because back then, we had no knowledge of the world of medicine. Wala naman tayong alam sa medisina. Wala naman tayong alam regarding the medicinal properties of plants and etc. Because we were ignorant back then in the ancient times. Pero paano tayo natuto as individuals? And how were we able to use our knowledge when it comes to the things, the phenomenon in our society to bring about care to our patients? Nursing started in the intuitive way of caring for the sick members of the family. Ibig sabihin nito, it started as a strong feeling, an intuition, okay, or a strong desire to care for a family member. The care that we gave was mainly intuitive in nature. That means it just came out naturally. Kahit na hindi naman natin alam mag-alaga, still, ginawa natin yun. Why? Because that's part of our human nature, to be carers. Lagi niyong tatandaan, traditionally, women's roles were wives, they were mothers, they were sisters and daughters, and they are the ones who are left at home to take care of the sick. Gaya nga ng sabi ko last meeting, the word nursing is, in English, literally translated to suck. To suck. Bakit? because it means to let a baby suck the bosom or the breast of the mother. Ibig sabihin, caring for the sick was actually a task delegated to mothers because they are natural carers. They don't need any knowledge, training, or skill to become good mothers, in the same way that caring or nursing just came out naturally from them. Throughout history, most nursing care were actually carried out by women or mothers who are caring for their children. And somehow, this caring practice transferred to caring for the sick. Anong ibig sabihin nito? Dati, yung mga nanay daw, sila yung mga inatasan na mag-alaga sa mga anak nila. But somehow, along the way, this skill transferred to caring for the sick members of the family. Kaya nga, nurse comes from the Latin word nutrire, meaning to suck. Because the first nurses were mothers who were caring for children. And then, nag-evolve sila into women caring for the sick. You have to remember that caring for the sick became a sole responsibility of those women and mothers who already had an experience of taking care of their own children, such as their family, friends, and even healers. Ang ibig sabihin niyan, noon po wala po tayong mga nurses. Ang meron lang po sa atin noon ay mga nanay, mga lola, at mga ate na meron ng sariling anak. And when these people, these women already had an experience of taking care of their children, they are also qualified to take care of the sick. Now, in most societies, women or the female sex did all the caring and nursing. Konti lang po ang mga societies or nations that incorporated healers and shamans who had the job of being a nurse. Konti lang po in the different nations around the world ang mga lalaking nurses. Because women were more qualified to become nurses because of the idea that they were able to raise their own children, take care of their children, and that positions them better to take care of the sick people kasi marami na silang experience sa pag-aalaga. While men do not usually do the caring or child rearing. Sila po yung mga lumalabas at nagtatrabaho at kumikita ng pera para sa mga families nila. Therefore, people eventually assumed that these men were not qualified experience-wise when it comes to taking care of the sick. Now, let us have a definition, conceptual definition of what a nurse is. Nurse can be a noun or a verb. When we speak of nurse as a noun, it is a person who is trained to take care of the sick or the infirm. But when we say verb, to nurse is to give medical attention or even to feed a baby at the breast. So, yun po yung definition natin ng nursing, and that is how nursing started in the ancient times. Now, let us also look at how nursing was in ancient civilization. During this time, there was no formal education and training yet for nurses. And providing care to sick patients revolves around magical thinking, superstitious and religious beliefs, and most nursing practices are usually based on folkloric beliefs of people. Yung mga pinapaniwalaan nilang practices na mga ani-anito, mga offering of foods to the statues of gods, mga paggamit ng mga herbs, mga ganito po, they are usually practiced in ancient civilization. Now, you have to remember that during this time, female slaves were the ones who provide physical maintenance for the sick. Ibig sabihin, yung mga slaves po or yung mga katulong, they cared for the sick at home dahil wala pa pong hospital that time. And during this time, nursing was considered of low status. Mababang uri ng trabaho po ang nursing noon because it is usually done by female slaves. And women who committed crime during the ancient civilization were given a choice to either become a nurse and take care of the sick or go to jail. So karamihan po sa mga babae na nag-aalaga sa mga sick clients are usually criminals or slaves na napilitan lang na mag-alaga ng mga pasyente. The actions are usually ordered by a master, a healer, or a priest. And there were no hospitals back then. However, hospitals became established as institutions of charity. Nagpatayo yung mga priests and mga monks ng mga house of healing, which we now call hospitals. And monks and nuns were the ones providing care to the sick. Now, sir, akala ko ba sabi mo kanina yung mga kriminal, yung mga nababae, yung mga nag-aalaga sa mga may sakit? Yes, that was a practice before. But then again, they become wayward. Mahirap silang kontrolin yung mga criminal na ito, yung mga slaves na ito, and they were the ones taking medications of their clients. Marami sa kanila pumapasok ng lasing and so on and so forth. Kaya po yung mga monks and nuns, they were forced to create houses of healing or what we call institutions of charity or hospitals para sila na lang yung mga mag-alaga sa mga sick individuals during the ancient civilization. In ancient Egypt, people worshipped the goddess Isis and her son Horus as they were believed to manipulate the dreams of the sick. And pag yung mga may sakit na nilalang or mga tao from Egypt had dreams of Isis and Horus, naniniwala sila ay gagaling. Bakit? Because Isis was believed to be the mother of nurture and healing. So as you can see in the picture of Isis here, siya po ay isang babae or goddess na nagpapasuso sa kanyang anak na si Horus. And when people are sick, they usually go to the temple of Isis and Horus for healing. Pero hindi po yan yung pinaka-notable na naging contribution ng ancient Egypt sa ating field of nursing and medicine. Ang naging notable na contribution po ng ancient Egypt is the Code of Hammurabi. Now, bakit po nagawa yung Code of Hammurabi? The Hammurabi's Code of Law was created because the pharaohs wanted to regulate the people who were healers or the people practicing medicine during that time. Bakit? Kasi there was no developed science and most diseases back then were not yet understood by people, and that these leaders, political leaders or ancient rulers, wanted to regulate only those people who can practice medicine. Kasi alam nila na pag yung mga kahit sino-sino lang yung nakakapasok sa medicine ay magiging dangerous ito sa kanilang society. So what did the ancient rulers do? Usually they blamed the physician for poor patient outcomes. So they regulated the medical profession. Kasi nga noon, yung mga pharaohs, ang sinisisi nila kung pangit or hindi na-heal ng mga medical practitioners yung pasyente, it is always the fault of the medical practitioner. Now, the Hammurabi's Code of Laws was considered to be the first documented code, which was the first intersection or the crossing or merging of medicine and law in the dawn of civilization. Now, dito po, nagkaroon na din po ng law ang practice of medicine because of the Hammurabi's Code. If the physician, according to the Hammurabi's Code, committed a mistake through omission or commission of a mistake, his fingers or his hands will be cut off, immediately stopping him from practicing medicine. Imagine, kung nagkamali daw yung isang doctor or meron siyang negligence, ang parusa sa kanya, tinatanggal yung kamay para hindi na siya makapag-practice ng medicine. Now, these severe punishments for negligence are supposedly to weed out the physicians that are not capable of delivering adequate care. In addition, it also prevented these physicians from practicing in a different locality. So dahil sa contribution ng ancient Egypt na Hammurabi's code, we now have regulations when it comes to practicing medicine, midwifery, pharmacy, and other medically related professions. All because of the ancient rulers. Pero, hindi na po natin ina-apply yung mga provisions ng Hammurabi's Code. Kasi ang pangit naman, nagkamali ka lang ng bigay ng gamot sa pasyente, tatanggalan ka ng kamay. So, hindi na natin pina-follow yan, but they have paved the way for us to create our own laws and regulations governing medicine and nursing practice. In the Bible, there is also a mention of nursing as a profession. And nursing roles were mentioned in the Old Testament as assisting in the care of children and infants during delivery. So usually the role of nurses or carers were actually as midwives. And according to the Bible, nursing truly is serving Christ as He commands us to care for one another. In particular, the healthy are called upon to look after the weak in their times of need. So yan po ay mga roles ng deacons before in the Bible. When we speak of deacon, they are usually public servants. And deacons usually offer their self, their health, and their lives in the service of other people, especially those who are sick and the weak. Yung nakikita nyo po dito sa picture, siya po si Saint Phoebe. And Phoebe was the first nurse mentioned in the Holy Bible. She was commissioned by Saint Paul as a deaconess serving the church, and Phoebe is said to have exemplified the early Christian ideals and values of charity and selflessness. And she gave care to sick strangers, she took care of orphans, and she also took care of travelers under her own roof. So siya po, si Saint Phoebe po, ang first nurse that is mentioned in the Bible. In our religion, specifically the Roman Catholic religion, the caring for the sick was usually based on the parable of the Good Samaritan. Di ba nga sa Good Samaritan po, yung isang traveler, nakita niya yung isang tao which was mauled by thieves. So, ninakawan nila yung isang tao, binugbog, iniwan sa kalsada. And then there was this Good Samaritan who took care of this person who was wounded on the ground. So, yun po, yung first mention din ng caring for the sick, which was the story of the Good Samaritan. The view of nursing as a ministry has propelled nurses for centuries to care for the needs of the whole person in the service of God. Karamihan po sa mga taong naging unang nurses, they dedicated themselves to caring and healing for these patients, not for money, but for service of God. The earliest nurses were caretakers of Christian faith who demonstrated God's love by tending to the physical, mental, and spiritual needs of the sick and the marginalized. Anong ibig sabihin nito? Majority of the people who were considered nurses back then were just extension of God's love to humanity. Ginagawa nila yon dahil sa gusto nilang ipalaganap yung good word, the love of God. While nurses work in the same setting as others in the healthcare profession, our job requires us to go an extra mile. And our job entails helping our patients to eat, to drink, to stay clean, and sometimes it also comprises tending to other people's wounds and care for other people. So, biblical po yung trabaho natin. Even the Bible has told stories about us. So you should always bear in mind that if you are here for the money, then you might not be in the right profession. But if you are here to make something out of your life, to find your purpose, to care for the people you love, then I pray that God will bestow you the knowledge, the skills, and the competence that you need to become professional nurses in the future. Pagpalain nawa kayo ng Diyos kung yun po yung rason kung bakit kayo nag-nursing. Now, in ancient Greece and Rome, they also took care of the sick. And the caring for their sick usually revolves around mythology. Bakit? Because they still believed in Asclepios, or the Greek god of healing. They also prayed for Epigone, or the goddess of soothing. And they also prayed to Hygia, the goddess of health and cleanliness and hygiene. Now, yung mga may sakit po, dinadala nila sa mga hostels and nursing homes. And these hostels and nursing homes were run by monks and laity people. So mga monghe po ang nag-aalaga sa mga may sakit, and some volunteer men and women who believed in Asclepios, Epigone, and Hygia also worked in those hostels and nursing homes. Now, before, these people did the healing, did the caring out of Christian love. Dahil lang sa pagmamahal nila sa kapwa, ginagawa nila ito noon. However, as time went by, they already accepted payment. So, ibig sabihin, in Greece and Rome, dito po tayo nagkaroon ng sense of professionalism. Yung care na binibigay na po natin ay binabayaran na po nila noon because of the practice of in Greece and Rome. Kaya yung mga nurses natin hindi lang dinadaan sa thank you, meron na rin silang sariling sweldo, and that is because of the practices of the people from Greece and Rome. Now, let us also look at nursing in Africa. Hindi lang nga lingid sa kaalaman natin that African women had to fight for education, for job opportunities, and fundamentally, for freedom. And since most of these people were sold as slaves, they usually relied on their ancient knowledge to forage the forest and freelance for food and medicine. Now, kahit na hindi nakapag-aral yung mga African women, they had knowledge that were passed down from generation to generation, and they had a wide array of knowledge or expertise when it comes to using herbs. So, in Africa, they see nurses as midwives or women who assist in childbirth and delivery. Nurses are also seen as herbalists, or the people who concoct or create medical elixirs and drinks out of medicinal plants. And they were also seen as wet nurses and caregivers for children and the elderly. Pag sinabi po nating wet nursing, this is the practice of letting a person's child suck on your breast even if that child is not your own. Ibig sabihin, pag wet nursing, pinapasuso mo yung bata kahit hindi mo anak yung bata. So, that was also part of the practice of Africans before. Tinitignan nila yung mga nurses as wet nurses. That is also part of their responsibility. Now, let us also talk about Florence Nightingale, who is the founder of nursing. She was a philanthropist who spoke multiple languages because she came from a rich family. She was also highly educated in mathematics, and she is the reason why nursing has been elevated to where it is now. She promoted the collegial relationship with doctors, and because of her, we are not anymore considered subservient to doctors. Dati-dati, ang tingin ng mga tao sa mga nurses ay katulong ng mga doktor. But because of Florence Nightingale, we are not anymore considered as handmaidens of doctors. Florence Nightingale was also the first to use research and statistics to elevate and enhance care of patients. And she also founded her own nursing school, which was called Nightingale Training School of Nurses. And she also was the first to design the first nursing curriculum, and she was the first person who usually designed the nursing educational system. So that's Florence Nightingale, the mother of nursing. Because of Florence Nightingale's contribution to the nursing profession, nursing has become both a science and an art, specifically in the 21st century. Philosophers and scientists still argue the use of empiricism and rationalism in the nursing profession. Ano ba dapat yung ginagamit natin? Should it be empiricism or should it be rationalism? Marami sa mga philosophers natin, they believe that knowledge should not only focus on understanding existing theories. Sabi ng mga nurse philosophers natin, dapat gumawa pa tayo ng mga maraming theory in nursing para hindi na lang tayo humihiram from other profession. However, scientists and researchers believe that knowledge should not only focus on the creation of theory and theoretical existence, but it should also focus on understanding of what is still there to be observed. We should focus on understanding different phenomenon. Yun naman po yung sinasabi ng mga scientists and researchers. Kaya nga po, now, nursing is in the middle between art and science because of this argument between philosophers and scientists. Now we have many major developments in the nursing profession. Right now, the use of experimentation to gain new knowledge has already emerged during this period as nurses like us strive to base our actions and decisions on evidence and scientific data. Marahil lagi nyo nang naririnig ngayon yung evidence-based practice or nursing research. Why? Because nurses in the 21st century are already absorbed with the idea that we really need to conduct research and use experimentation to further and enhance our clinical practice. Aside from that, we are already using positivism. Positivism became prevalent during this era in the discovery of truth for the development of science. And when we speak of positivism, it is hard sciences, hard facts, mathematics, statistics. So yun po yung ginagamit natin na approach in research, specifically quantitative studies. So naging uso po yung positivism in the nursing profession because we were trying to develop nursing as a science. Aside from that, empirical and objective data already started to coexist as the focus of interest of study, as one of each need to be tested in order to determine what is true and what is not. Ibig sabihin po yung mga experiences natin, which we call empirical data, are already tested objectively because of research. Kaya po nagbabago yung mga practices natin because of the presence of research, because of the use of objective data, which are testing the theories that we have. Kaya po napaka-importante ng nursing research because they are the ones elevating our knowledge. Sila po yung nagsasabi that this theory is valid, this theory is not valid, because of the presence of nursing research. As a result, different points of view during this period, there is a growth of new knowledge and science, and nagkaroon po tayo ng mga different na sangay or branches of nursing because of these major developments. And gaya nga ng sabi ko kanina, because of the major developments, we had so many branches of nursing right now. And because of that, we now have different roles as nurses. Kung dati, taga-alaga lang tayo ng mga may sakit, ngayon marami na din po tayong mga types or roles or responsibilities as nurses. Number one dyan is the primal or fundamental role of nursing, which is being caregivers or care providers. Nurses provide comfort for persons together with preserving the dignity of the human being. And we nurses are also expected to help our clients maintain and regain their health, manage their disease, and alleviate their symptoms and attain maximal level of function and independence through our healing process. So, ibig sabihin, tinutulungan natin yung mga may sakit to feel better and also to return to their usual state or even better. They are considered the mother role. Caregiving is also considered as the mother role of nurses, or that is the fundamental role or responsibility of nurses to become caregivers. As nurses, we also have a role of the communicator. So, ibig sabihin nito, we facilitate the understanding and collaboration of nursing action within our clients and the other members of the healthcare team. Dito po pumapasok yung ating role as health educators or health teachers. Bago yung pasyente ay lumala, binibigyan natin sila ng health education, and before a patient goes home from the hospital, nagbibigay tayo ng mga discharge instructions so that the patient can be informed how to properly promote his health, prevent diseases, and maybe even rehabilitate himself on the process. Aside from that, meron din tayong role na tinatawag na communicator when we work with other members of the healthcare team. As nurses, we have a job to advocate for our patients. Ibig sabihin, tayo po yung mga nagiging voice ng mga pasyente natin. So, if the person or if the patient cannot communicate his needs or the care that he wants or the decision he would like to the doctor or to the other members of the healthcare team, tayo po yung nagsisilbi na voice nila. So, one of our roles or responsibilities as nurses is being a communicator. Now, nurses also have a role of being educators, as mentioned earlier. And as educators, we should help our clients learn the state of their well-being or to understand their sickness better or their situations better. And also, we help them understand the therapies that will be done to alleviate their condition. So, ine-explain po natin lahat ng mga gagawin natin sa mga pasyente. And we also provide them the imagery of the advantages and disadvantages of the actions that will be done to them. So, tinutulungan po nating mag-decide yung mga pasyente natin if they receive the medication or if they don't. So, it also helps also in nursing education, yung role natin as educators, because as a clinical instructor or as a nurse educator like me, you have to have a deep understanding of the concepts of nursing, the theories surrounding nursing, so that you can become a better educator and so that you can also ensure the pipeline of nurses. Ang pangit naman kung yung mga bobo or yung mga hindi masyadong marunong magturo yung mga nagiging nurse educator. So, ibig sabihin, bumababa po yung quality ng mga nurses natin pag ganun yung nangyari. Alright? So, if you want to become an educator someday, make sure that you understand these concepts of nursing so that you can pass on the knowledge that we have to the next generation of nurses. As nurses, we also take on the roles of the counselor, wherein we provide help to our client to cope with their stress that is usually brought about by their health conditions. And sometimes, we also offer ourselves, our shoulder to our patients to lean on in times of need or difficulty. So yung mga pasyente natin, pag sila ay worried, sila ay fearful, sila ay anxious or angry, minsan tayo po yung mga nag-i-intervene doon. We give them counseling so that they can better take a reign of their emotions. So isa din po yan sa mga roles natin as nurses. We have to create relationships with our patients so that we can give them proper advice. We also are given the role as leaders pag tayo ay mga nurses. Bakit tayo tinawag na leaders? Because we have the ability or the power or the position to influence our clients in making decisions that are directly affecting their health. And this will also help them establish and achieve their goals towards alleviating or improving their condition. So kayo po yung isang nagiging leader ng mga pasyente nyo because you are able to guide them to choose the best option for their condition. As a nurse, you are also given an opportunity to become a change agent. We nurses work with our clients to address their health concerns and we also bring about change in their lifestyle. Hindi lang po sa mga clients natin nagiging change agents tayo. When we become researchers, we are also able to change the way our society thinks, the way our world works pag tayo ay naging researcher at mga naging nurse leaders. So, as nurses, we can become change agents in our society by improving the lives of our patients and also the lives of the people around us. As nurses, we also take on the role of the manager and we establish an environment for collaborative client-centered care to provide safe, quality care with positive client outcomes. So, ibig sabihin nito, tayo po yung mga nagmamanage ng care sa ating mga pasyente and we coordinate with the other members of the healthcare team. Kung hindi kayang sabihin ng pasyente yung kanyang mga gusto sa ating mga other members of the healthcare team, we are the ones organizing and coordinating with them. So, malaking role din po yan na ginagampanan natin, which is the role of the manager. And like I said, we can also become thinkers or researchers when we are in the nursing profession and we investigate the role of nurses, the role of this phenomenon, and we are able to explain the different problems, the relationship of different variables when we are nurses as researchers. So, pwede din tayong mag-create ng mga sarili nating theories when we become expert researchers. And by doing that, we elevate the quality of nursing practice that we are able to give to our patients. So, makita nyo naman no, ang daming mga pwedeng gawin when you are a nurse. We have so many roles and responsibilities to play when we become registered nurses in the future. And that concludes another pre-recorded video lecture for the subject Theoretical Foundations in Nursing. Sana po ay marami kayong natutunan at natuklasan sa ating video ngayon. Again, this has been Dr. Jeffrey Reboron and I bid you thank you, God bless, and enjoy the rest of the day. Please stay alive.